Hello everyone to another episode of Ask FUH with Fakir University Hospital. This month we raise awareness about breast cancer, and today we will be discussing a more unspoken part of breast cancer, which is male breast cancer. And today with us we have Dr. Robert Herner, who's our German board certified consultant plastic surgeon who works specifically in this area and who's here to shed some light on male breast cancer and its symptoms and how it is managed and treated. So Dr. Robert, thank you for joining us today.
Thank you for having me.
And let's get into discussing breast cancer in males. So doctor, this is very unspoken of, and to be honest, for the first time after we have been talking about breast cancer for so many years, we had somebody like you come up and talk to us about it and shared some information with us. Tell me, can men get breast cancer too? Is it common?
Yes, men can get breast cancer too. It's about 100 times less frequent than in females, so it's 1 out of 800 male has breast cancer. It's a big number, but the real problem is it's a forgotten number.
Yes, men I think definitely feel ignored when it comes to the pink colors and the pink month. And thank you for sporting a pink color today. It's not only the color for females. So what are the main clinical symptoms that we would see for breast cancer in men?
Men and female have the same symptoms. So there is the main symptom is a lump, a painless lump in your breast that you suddenly feel that don't go away and that goes bigger and bigger. Other symptoms are changes in the skin. Skin becomes more big, skin changes color, and finally there are changes in the nipple with retraction of the nipple or even secretion coming out of the nipple.
So does it happen at a certain age also? Like in women we say that over 40 the risk is higher?
Yeah, it does. It's more in the elderly men, in the men above 50 years of age, because breast cancer is related to the female hormone estrogen, and even men has estrogen, and if we are beyond the 50, man has the adrenopause, which is the equivalent of the menopause, and then the amount of estrogens is rising.
That's very interesting, doctor, to know something like menopause happens in men as well. Maybe we will talk more about it. So why would you say that breast cancer in men is so problematic?
See, is all about awareness and early detection. There is no awareness in men, so we detect the breast cancer at a much later stage. The higher the stage, the more the worse the prognosis of healing.
I think it's also to do with like we don't think that the breast cancer itself can occur in women because so much awareness is about breast cancer happens in women with only certain genetics and at a certain age, and people just shy away from getting it tested or detecting it, right?
Yes.
So what can be done that we have been doing so much to raise awareness for breast cancer in women. What can be done for men?
Well, there are two things that can be done. The first thing is just to use this energy you're using for women and just include men. Make the Breast Cancer Awareness Month not an exclusively female topic, but make a couple event or an event for male and female out of it.
Yeah.
And the second point is, men have breast growth. And about 30 to 60% of all men, depending on the age, and certainly when they are older, they have some breast growth. And breast growth in men is called gynecomastia or male boobs.
Okay.
And if we modify our diagnostic pathway for the male boobs or gynecomastia, we would find a lot more breast cancers in a much more earlier stage.
So what's the main difference between having the gynecomastia and the breast cancer?
Gynecomastia is breast growth, either growth of the breast gland by the increasing influence of the estrogen or increasing of the fat around. The main thing is that gynecomastia in almost all cases appears on both sides, and a cancer normally in most of the cases appear on one side.
Does it happen that somebody having a gynecomastia can also have breast cancer?
It does, and there are countries where when you do gynecomastia surgery, you must send the breast tissue to pathology. That is what we do for female breast tissue, but we don't do this for male breast tissue. But in countries where this is the case, we really have a much higher breast cancer rate, and the detection is about 1 to 2% of all operated gynecomastia cases.
So, doctor, who in men are more at risk? Like we talked about age, and what other factors could be causing breast cancer in males?
Well, the hormone treatments are radioactive X-ray or rays is always a risk to have breast cancer. Otherwise, they are the same risk factors like obesity as in women. There's no difference.
And genetics?
Genetics play the same role. We have the same markers positive in male and in female if you only look for it.
All right. And the cancer history, like somebody, if they have had other types of cancer in the family, let's say somebody has had prostate cancer in the family and other types of cancer in the family, does it happen that they will also get breast cancer, maybe at risk of it?
Well, there are some cancers that have the same origin, which are associated with or which have, let's say, higher risk of breast cancer if you have those in your family. But those are the same like for the women, except for the ovarian cancer. This does not exist in male. However, you have the prostate, which has a small link to the breast cancer.
I'll add one more last question to this out of my curiosity. So you're a plastic surgeon, and first of all, like plastics as a aesthetic treatment that is required, is it necessary for after breast surgery, and who should be choosing it, and what are the main reasons somebody chooses that?
We'll see. A plastic surgeon is also a reconstructive surgeon, and our part where we are trained for is we reconstruct the breast in female and in male, because the breast is a very important aesthetic region for both gender. It is important to have a minimum of disfigurement after a resection of a tumor. Just get me right. You need two different surgeons. You need one surgeon removing the tumor, and this tumor removal is the most important thing, because if the tumor is not removed, you will have the cancer. But then, once the tumor is completely removed, then the second surgeon comes in. So it is a team of two surgeons which are working independently, which is very important because the one who is concerned with the tumor resection does not need to think about reconstruction, so he's not making any compromise in his resection. And the other one has to cope with what the other left behind. But that is what we are trained for.
Wonderful. So it was very enlightening for me, very insightful. Thank you, doctor. It's a joint team approach from what I understand, that a breast surgeon is required and a plastic surgeon is required to bring back a certain kind of normalcy when it comes to, when somebody is going through cancer. And also the most unspoken of, or the unsaid part, or what we also talk about in breast cancer in females, that it is the males who can, further help the women to by asking them to take extra effort to check themselves, and they can themselves also check themselves if they have a history, or like you said, there is an age factor or a genetic factor, and the entire family could be cancer free, or early detection can help save lives, as we say.
Exactly.
Thank you again for joining us today. Thank you so much.
Thank you so much.
Thank you.